Patient-oriented research aims to empower, you guessed it, patients as equal members of the research team. But how do you know if patients, or patient partners as we like to call them, will really be engaged in the research process? Luckily, we have a tool for that. PORLET, Patient-Oriented Research Level of Engagement Tool. The PORLET was created when a group of patient partners, while reviewing grant applications through a patient lens, discovered a need for a standard set of criteria and a consistent and fair way to measure the planned level of patient engagement. The PORLET was designed to measure how closely a project aligns with the definition of patient-oriented research as described by the Canadian Institutes of Health Research's Strategy for Patient-Oriented Research. The 5 levels of engagement, inform, consult, involve, collaborate, and empower, are adapted from the International Association for Public Participation. Since it was launched several years ago, the PORLET has undergone validity testing. Some recommended changes were implemented: develop a companion guide, clarify confusing wording, reorganize criteria queues, and now we're proud to share PORLET 2.0, and still the patient-oriented research level of engagement tool. PORLET 2.0 is a useful tool when reviewing grants, writing grants, reviewing and writing abstracts, and training others in patient-oriented research. PORLET measures 5 criteria: patients or partners, patient-identified priorities, outcomes important to patients, aims to integrate knowledge into practice, and team is multidisciplinary. Each of these criteria are rated on a scale of 1 to 5, and the cumulative total is used to determine the level of patient engagement. Once we discovered a way to measure the planned level of patient engagement, our patient partners and the Indigenous Health Advisory Council felt we needed a way to measure the planned level of Indigenous community engagement as well. And so together with the Indigenous Peoples Health Research Centre, we developed the IRLET, Indigenous Research Level of Engagement Tool. So what is the SCpor IRLET? The IRLET is a tool. No, not that kind of tool. That measures the degree to which a project meets patient-oriented research criteria in the context of Indigenous communities. The IRLET was developed because historically, research was conducted on Indigenous peoples, not with or by them. The IRLET provides guidance to researchers and grant review committees who are involved in or are new to Indigenous research to ensure they are planning and executing their projects in an appropriate manner. The IRLET can quantify the level to which an Indigenous community or organization will be involved in a research project. The IRLET is based on Tri-Council Policy Statement Chapter 9, Research Involving First Nations, Inuit, and Métis Peoples of Canada. IRLET measures 4 criteria: partnership with Indigenous stakeholders, knowledge into practice, strengths-based approach, and Indigenous knowledges and ways of knowing. Like the PORLET, each criteria is rated on a scale of 1 to 5, and the cumulative total is used to determine the level of Indigenous engagement. When it comes to measuring the level of engagement, leave the guessing behind with PORLET for patient partners, along with IRLET for Indigenous communities. For more information, please visit us at scpor.ca/PORLET.